Welcome to DonorConnect, Caring for Our Kids, the Mental Health Toll on Children. The Community Foundation of Greater Des Moines hosts these DonorConnect events as a main part of our mission to connect donors to causes that you care about. We're so glad that you could join us today. This is such a timely topic, and we are looking forward to hearing about how our community is supporting the best care for our community's youth. During this program, you can ask questions in the Q&A or the chat feature, and we'll get to them as best as possible. If we don't get to your questions, I will follow up with an email with a response to you. So don't worry about that. Now I'd like to introduce Angie Deflis-Trenton, our Chief Charitable Impact Officer, who really connects our organization to this work in our community. Angie, welcome. The Community Foundation is involved in many community initiatives, including conversations around mental health. Can you share a little bit more about the Community Foundation's involvement in this particular topic?
Absolutely. Thanks so much, Sarah, and thanks everyone for joining us today. So you're right, the Community Foundation, one of the key elements of our mission is to provide leadership on important community issues. And for us, mental health is an important community issue. And thankfully, there are lots of leaders who we have been able to work alongside in various ways. I also think, the conversation around mental health, brain health, as Tony will talk about on our panel today, have not only been elevated, but I think also the understanding of ways in which solutions can be executed is also, seeing some heightened conversation in our community, which is huge. So a little bit more context, like you were asking about, the Community Foundation back in 2014, which seems like a long time ago, but in the grand scheme of things is not that terribly long ago, we had the opportunity to work with the United Way of Central Iowa and the Mid-Iowa Health Foundation. And we came together as three organizations committed to supporting the sector, the nonprofit sector, and hired a firm called the Technical Assistance Collaborative. And they went out throughout the Central Iowa community and listened to stakeholders who cared about understanding both the gaps and the opportunities when it came to services, specifically mental health services. The thing that I loved about that work, Sarah, was that there were conversations with the healthcare providers, with law enforcement personnel, with schools, and county and state personnel, and most importantly, I think, conversations with folks impacted, families and individuals who are struggling and who have a voice that needed to help inform what our community could do moving forward. So I think the thing about that report, Sarah, that was really exciting too, was that it elevated that things that we do really well in Central Iowa, we collaborate.
Wow.
Yeah, we understand innovative strategies, all those types of things. But it also talks about those services and barriers and insufficient supports were some of the things that was brought to our attention.
I love that, collaborating with our community partners, not creating the wheel. I love that we lean into conversations like this. So that was 2014. So what has evolved since then?
Yeah, well, so the interesting thing, so in 2014, that report highlighted a bunch of different recommendations. I think there were 11 in total. And the number one recommendation that was discussed back then, Sarah, was the idea of establishing a children's system of care, and specifically about improving outcomes for kids and their families, as well as supporting the organizations that are there for those families in times of crisis. So from that particular information in 2014, it was really in 2017 that we again were able to partner with United Way and the Mid-Iowa Health Foundation and provided some dollars to help the community collaborate and learn together to plan what's next. And a great amount of appreciation to Orchard Place for initially convening what was probably 75 or so individuals and organizations together, again, ensuring the parents and the youth voice in all of those discussions to help elevate some things that we needed to do better in our community. And most importantly, we could do better in our community. And so that was really I wouldn't say the start, but really was an additional way to make a tidal wave on this progress in the region. And some of the things that were highlighted were better understanding of the continuum of services that are provided to youth and families, understanding what emergency support looks like for youth and families. And another thing that we'll hear more about today was identifying that we really needed a safe environment for families and young people when they're experiencing a mental health crisis, to help really stabilize them in that time. And we needed a space that would be safe for folks. So it's going to take a lot of people to make progress. We've made some progress. There's a lot more, certainly, but I think that's why I'm so excited to turn it over here pretty soon to our panel. So hopefully that gives some context there about where we've been and hopefully about where we're headed.
That is such great and helpful background information, Angie. Thank you so much. I personally am really looking forward to this conversation, so I don't want to take up any more time, and I would love to turn it over for you to introduce our panelists.
Great. Thanks, Sarah. And I'm going to invite 3 key community leaders to join us and turn on their cameras today. Hopefully that background was at least shines a light on sort of the perspective that the Community Foundation is coming to this discussion with. And a lot of those investments, we talk a lot about this idea of better together. Those investments came from our Better Together Fund, but more importantly, I think they really lean into this understanding that the Community Foundation has, that it takes all of us to create the type of community and the quality of life we want to see. So I'm looking here at 3 amazing colleagues and 3 amazing organizations that believe that to be true as well, that it takes a community. So I want to introduce briefly Dr. Jen Wells, who's the Executive Director of Please Pass the Love. I also am really excited to have with us Tony Raymer, who serves as the Director of Brain Health for Easter Seals, Iowa. Tony, we're going to ask you to talk about that choice of words there too today, which will be great for those attending. And also another great friend and colleague in the community, Jody Warth, who's the Vice President of the Child Guidance Center for Orchard Place. So thank you to all 3 of you and your organizations. These are passionate leaders, folks, who are here today. I would say they all are personally and professionally committed to making sure that young people have the social and emotional supports they need to live and lead successful lives and have successful futures. So before I turn it over to them, they are going to give you the highlights of their organization. But I just want to take a minute and sort of like ground us in this conversation today. And I want to remind everybody that this topic hits people and impacts people differently. We all have an experience with mental health and mental illness challenges in our lives, and we reflect in them differently, and it stirs up emotions in us differently. So I just want to make sure that you take your own time during this conversation. If you need to step away, if you need to pause us, whatever it is, and I know that the 3 folks here on the screen are going to have some authentic conversation today, and so I just wanted to recognize that this may be difficult. But there will be progress. So for that, I am grateful. So I'm going to turn it over to the 3 of you, and let's start maybe with Jen to share a little bit just about Please Pass the Love in your organization, and then we'll move to Jody and Tony before we really dive in. Jen?
Thanks, Angie. That was a beautiful way to set the stage for all of this. My name is Jennifer Wells. I'm the Executive Director of Please Pass the Love, and I really appreciate that the foundation has committed themselves to youth mental health, especially. I get to sit here on this panel with 2 other amazing orgs, and I will definitely props to them for the work that they're doing. Please Pass the Love was started in 2013. We used to be a small nonprofit, and we're rapidly growing. Mental health is such an epidemic throughout the state and beyond that we can't keep up with the need. Our mission is to transform school mental health. So we really focus on the school mental health aspect through leadership, social justice, and collective change. We have programming that stems from comprehensive school mental health planning, so data collection, action planning, intensive training, to youth programs, Stomp Out Stigma, school mental health clubs, the Midwest School Mental Health Conference, and most recently, we help pivot in the community. So Tragedy at East High School will be supporting their staff today, tomorrow, and then their students for the rest of the school year and beyond.
Thanks so much, Jen. Jody, a little background about the work of Orchard Place.
Yes, thank you. My name is Jody Worth, and I am the Vice President of the Child Guidance Center, which is one of 3 pillars that fall underneath the overall not-for-profit that is Orchard Place. Our mission is developing strong futures. First of all, I have to say thank you to the Community Foundation for bringing this up. I truly believe in my soul that our kids grow up once and that they are our responsibility as a community. So we are better together. We need to hold hands and embrace what's going on with our kids and our adolescents and our families. And so I just thank you so much for bringing this to bear today. So Orchard Place is the oldest locally based charity in Des Moines, interesting enough. We provide mental health treatment and expertise for Iowa's children. We serve far more than just the metropolitan area. We reach all areas of the state. We serve 7,500 children and adolescents through inpatient, outpatient, and our community-based services. As I indicated earlier, we have 3 branches. So we have our PMIC facility, or our residential facility. We have our Child Guidance Center, which is a outpatient child's mental health facility. And then we have our PACE Center, which does all things community-based. So we do BHIS services, IHP services, and substance abuse programming out of our PACE Center.
Thanks, Jody. One thing that in the sector, and especially in this work, I know we got a lot of acronyms. And so the nice thing is Jody will be able to dive into a little bit more about what that looks like for families. So much work happening at Orchard Place as well. And so turning it over to Tony now for some overview on what's happening with Easter Seals, Iowa. Tony?
Yeah. Hi, everyone. I'm Tony Raymer. I'm the Director of Brain Health at Easter Seals, Iowa. I'm also a social worker. Happy Social Work Month to everybody. Easter Seals has been in Iowa for over 90 years. We work to build 100% equity, inclusion, and access for all people, especially for people with disabilities and their families. We work with people across the lifespan we have a fully integrated child development center here at Camp Sunnyside, and provide support statewide, especially for farmers who have a newly acquired disability, to allow them to be able to continue to do the work that they love in their communities. The privilege of supervising our brain health programs. We provide outpatient therapy, as well as crisis stabilization services for kids in Polk County, both residential and community-based services. And then for kids and families in Dallas, Ottoman, and Guthrie counties, we also provide residential services here at Camp Sunnyside. And like Angie's pointed out, my title's Director of Brain Health, right? So we're talking about brain health because our brain health, our mental health is the only kind of health thing where we tend to blame people. And there's a lot of stigma, and we're hearing a lot from kids about how they're being treated in schools by their peers because of their brain health symptoms, how that's manifesting in their lives, and that reminding all of us, our brains, they're in our bodies just like everything else. This is an illness. It's not something that someone brings on themselves, causes themselves. And we as a community are here to help support one another in overcoming it, just like we helped someone overcome the loss of a leg.
Thanks, Tony. Such a good way to sort of tee up this discussion. So the opening phrase of the invitation said, youth in our community, it's often said that they're resilient, but they're not invincible when it comes to mental health challenges in their lives. And I think, Tony, how you teed that up really sort of resonates with me, that kids are not invincible. And Jen, I'd love to invite you to kind of give an overview for us about what is the context that we're seeing in our community, in the lives of kids right now, that would be really helpful for us to have as we continue the conversation today. So Jen, I'll turn it over to you for some of that overarching information.
So this is hard. Angie posed this to me, and I thought I've got a few minutes to give you the context of what is really a train wreck and a catastrophe. So one of the things that's really important to remember is that mental health has been an issue long before COVID. our state has been struggling with how do we meet the needs of kids long before the pandemic was a thing. So think about it this way. When you build a house out of toothpicks and a storm comes through, we can't act shocked when that house burns or falls down, right?
Mhm.
So we had a system built out of toothpicks. So we had like a couple of ad hoc things put together, and then we had a catastrophe pandemic roll through, and we saw the impact of not having a system with some of the outcomes we're seeing. So one example is last year when we look at 2020 and 2021, nationally, our suicide rate actually went down by 5%. In Iowa, preliminary data indicates opposite. There's a reason for that. Before the pandemic, our suicide rate was already higher than the national average with a steeper trajectory. In the nation, suicide used to be the third leading cause of death for young people until 2016. Then the CDC caught up, well, our data nationally caught up to the state of Iowa. Iowa has been there for many, many years prior to that, where suicide was the second leading cause of death for our young people. Now, I also was just given, it's not public yet, but the 2021 Iowa Youth Survey will come out publicly soon. Preliminary data on that is showing that in 2018, we saw 21.4% of our young people had seriously contemplated suicide in the year before. We're seeing similar data in the 2021 youth survey, but we're seeing with our 11th graders, 24%. So a fourth of our young people, especially our older ones, seriously contemplating suicide in the year before. Another interesting piece is of those 24%, over half of them have a plan. So when we look at suicidal ideation and we're assessing that, one of the criteria we use is asking young people or anybody, do you have a plan? So if you're thinking about suicide and you have a plan, it's a little different than if you don't, because we want to know how committed are you to this? How much have you given to it? So we're seeing an uptick in not just our data, suicide ideation, but those that are looking towards completion as well. In Polk County in January, we saw our suicide rates double in comparison to the year before. We anecdotally are hearing in our urgent care, behavioral health or urgent care, to our ERs that they're seeing more kids depressed, more kids having anxiety, more kids with suicidal ideation. I'm sure Jody can give you a whole bunch of data on that as well. I personally want to just give this little caveat too, because I come as a professional, but I also come as a mom in this community, and I have a child with significant mental health needs. There are not as many people as well educated and connected in this community than me. And I say that factually because in the last couple of years, I, as a parent, have struggled trying to find my own children comprehensive, good, effective care and have been turned away right and left. And in fact, Jody at Orchard Place, they can tell you, they saved my child's life. So I will tell you that if you're looking at donating places, donate everywhere, right? But Orchard Place is working with some of our kids that have been otherwise outcasted. And we have another epidemic in the state of Iowa in the sense that we have this narrative that says we need to just increase professionals. That's not it. And I'm going to link a resource, a new book that just came out in a second called Healing, Our Path from, and I should just link it now, Our Path from Mental Illness to Mental Wellness. One of the things that we need to be very careful of is that having professionals, numbers of professionals, does not equate with high levels of quality care. We only have a couple of agencies, Orchard Place being one of them, YSS being another, that are willing and able to work with some of our most needy families and children. So I just put a link to a book, came out from Dr. Insel last month. It is one of the best books I have ever read, especially on the fire that is our youth mental health system. I would strongly encourage all of you to read it, to have a better understanding that our house is on fire. So what are we going to do? What are we going to do about it? So now coming back really quick about, locally, when we're looking at the mental health piece, this is what I'm seeing. So we have this catastrophe, right? We know that as a system, and a lot of the work that I do is system-based. So we know that we don't have these pieces in place. We know that we have a lot of well-intentioned people, but we have to make sure that our policymakers and our decision makers are also using evidence-based practices to navigate what they're doing, because we can be very counterproductive. You can't just throw money at something if you aren't enacting policies that are evidence-based practice to help advance mental health. So if I enact transphobic law, what I'm actually doing is I'm creating potential future catastrophes, especially for our trans youth, that is not only costly, but it's absolutely dangerous for our kids. We work locally, but we also work statewide. We have a local district that in the end of January, the last 2 weeks, they lost 3 young people to suicide, the youngest being a 5th grader. So when you're thinking about within your community, in the past, we used to think, this is just an older kid thing. It absolutely isn't. And so the work that we're doing when we talk about mental health, when we talk about school mental health, it actually starts with our little ones. Now, I'm not going to talk to a 3-year-old about suicide, but I am going to age appropriately talk about feelings. What are feelings? How to identify feelings? Because when we start to identify feelings, then it helps us in the long term to be able to regulate feelings. So all of this work is really, really important, but we have to do it comprehensively. We have to build a strong, sustainable system, because if we do not do that, we are just continuing to throw money and efforts at ad hoc things that may or may not help.
So Jen, one question that I see here in the chat too, and I think the framing of understanding the data around the suicide in particular is helpful, just because of how intense and how significant that is in terms of just a number. So the question is, out of that 21%, is there really any sort of commonality that we're all seeing, or that can be drawn in that? Or are we truly talking about something, to Tony's kind of comment before, like it transcends, and there's not one particular element that we can look at? What's our reaction to that? Like who is the most likely? How do we respond to that?
There has been research that was done on that, and it was earlier in the 2010s that the profile that we're seeing, and it was then, it can shift. And it doesn't mean, when I say this profile, doesn't mean these are the only people attempting, because we used to say it was boys that were completing more, and we're seeing now that girls are catching up with in terms of completions. But when one of the studies had been done, it was young white males, 10th and 11th grade. So a captain of the football team, lead in the play. We're talking about dynamics that have everything to do with gender norms. So males, you're supposed to be this way, act this way, do this, man up, whatever that means, but we're not teaching those coping skills. It's also, while we look in the state of Iowa, we have a suicide rate for farmers that is astronomical, through the roof. It's because we don't talk about these things. It's because we push back on teaching things that are really critical, like coping skills. And we say things like, nope, that's parents. Parents have to do that. Well, let's stop pretending that parents magically have all these skills. Let's flip on the news and look at adults and see how well adults are coping with the world. So it's a very complex piece, but that is what has in the past been studied. I also, really quick, and then I'm going to stop talking the rest of the time. I put a link in the chat. We did some preliminary data collection with parents across the state, and a lot of them were local. And this is just highlights. I have not written the report, so you're all getting a sneak peek. But look at what parents in our community are going through. Look at some of those co-pays. Families paying $300 for each therapy session. What? That's astronomical. That's insane. Look at some of those comments of what families are trying to go through. And Tony talked about the stigma and talked about, parents and kids being ostracized for mental health. It isn't about the stigma as much as it's about mental health justice and discrimination because of mental illness. I'm tapping out.
Well, no, but I think this is great and leads into the conversation. So Tony, I think a couple of times I was seeing you really nod there in terms of reflection. So what do you have to add to what was framing for us?
we're seeing kids, I mean, especially our LGBTQ youth have a significantly higher rate of suicidality in our communities, and attempts completion because of the way that we, the adults in their lives, are talking about people and treating people. We're not being great models. We're hearing from kids who, honestly, the accommodation we had to help one young man get was an escort from class to class because of how the other kids were treating them in the hallway in between classes, or other kids who, because they've decided to continue to wear their mask, are being like physically and verbally abused by their peers, right? And that we are modeling this as a society in general. And of course, our kids are going to take that on and show us that through their behavior. Right?
So Jody, with some of the work with at Orchard Place too, thinking about what Tony is describing and the folks that you're serving through Child Guidance Center, are you hearing some of those same types of things right now? And what ways has Orchard Place been able to support families and young people who are struggling with both those, maybe, I don't want to say significant, I can't think of the word, but on that full spectrum, right? From all the way across. What's your reaction at Orchard Place?
Well, I think it's really important to build on what Jen had said, was that if you step back and look, our students have not had a typical school year since the 2018-19 school year. And that is when our current fourth graders were in kindergarten. That's the last typical school year they've had. So the stresses, the isolation, the stigma, the loss of opportunities that they've had, the loss of interactions, masking has been there's a tremendous downside to masking in that you cannot see facial expressions or nonverbal cues from your peers. So we're seeing huge increases in suicidal ideations and thoughts, isolation, anxiety, depression. We have started, well, and I guess I want to back up. I hadn't planned on sharing this, but I did want to also share a little bit with what Jen was saying, in that it's so very difficult, even when you have all the resources at your fingertips, to get the help that you need for your children. I am the mom of a young man who took his life 2 years ago. And we did everything we could, and we still didn't win. And so it's crucial that as a community, we hold on together to these kids and that we put systems in place that protect them. The pandemic has definitely acted as a multiplier, if you will, for mental health for our kids. Well, I'm sorry, one unique thing that we did here at Orchard Place is we hired an intake assessment therapist. And what this, because our waiting list is so long, it's about 6 months right now. What we did is we have a therapist, and his sole responsibility is twofold. One, to see clients as soon as they present themselves. So they're seen within about a week. They do a complete assessment or a comprehensive assessment on that particular child and family. And then we determine what kind of supportive services we can provide them while they sit on our wait list to get into a therapy episode. So that happens right away. He also is a resource to them through the waiting period, if you will, while they're waiting to get in to see a therapist if something were to occur. Secondly, we started what is called time-limited cognitive behavioral therapy. And that is we're pulling folks off of our wait list that could benefit from a very time-limited, intense therapy interaction or session. And that is also done by our intake assessment therapist. That has also allowed us to pull some people off our wait list that really need to be seen sooner than later and get them a pretty defined set of therapy episodes. But really, hopefully the goal is to stabilize them and get them connected with other services in the community. And we've done that definitely as a reaction to the pandemic and what we're seeing happening on our wait list.
Jody, first of all, I just want to express gratitude for your willingness to share such a personal, statement with all of us. I value that so much, and I think one of the things that I love about this community is that we come together and support each other, and things happen to all of us. And I'm very grateful for your willingness to share that. And I think this is why we're having this conversation, right? There's
Yes.
not necessarily a profile, and there's not, it doesn't fall to parents, and it falls to community, and what can we do together to support each other, kids and families. So one thing I wanted to ask, you were talking about this intake assessment specialist. I think that's a really interesting idea about kind of how do you sort of, is triage the wrong word here? But how are you thinking about that care? And my mind goes back to what Tony was saying, like for a bodily injury other than the brain, we've got that sort of approach. Is that a good way to think about it, Jody?
Absolutely, you're spot on. It really is a very highly skilled therapist triaging our clients to make sure that the ones that are in the most difficult places get seen as quickly as we can get them seen.
And I want to also build off of Orchard Place in their services. Polk County right now has a lot of ARPA. A lot of people have a lot of ARPA money, which is good and bad, right? We had the pandemic, and so there's a lot of money out there. It doesn't mean that people are using it well or using it with evidence-based pieces, but Orchard Place has a great model of how they comprehensively look at kids. So I receive services, my family does, through Orchard Place, and we have intensive, comprehensive through integrative health, their integrative health program, where people help me navigate if I need that. That is the system that then needs to be moved, because all families need access to that. They don't need to just call 211, and I'm not throwing shade at 211, but what I'm saying is, when you have lived health experience, you need somebody, a family navigator, to help you navigate a very difficult system. So how Orchard Place does it needs to be broadened up so that all folks have access, and they just don't have the capacity to serve endless numbers of folks unless you hyperfund them.
Thank you, Jennifer. Yep.
This is this idea of sort of this continuum of support, right? So I'm thinking back to those initial reports that, in 2014 and 2017, like how do we really think about holistic support for kids and families? And so Tony, I'm wondering, I think the crisis stabilization work that I know Easter Seals is helping to sort of fill in the community. Could you maybe talk about that as because I think we're getting to that overarching system work, and I'd love to bring that into the conversation.
Yeah, absolutely. So following kind of, you talked about some work in 2014 and 2017, we finally got legislation passed in 2019. I think they've been working on for 40 years to develop a children's behavioral health system in Iowa, right? So we finally got this through in 2019, and it transferred some responsibilities and coordination to our mental health disability services regions. And so here in Polk County, that is Polk County Health Services, does all of that for the physical Polk County. The region to the west of us is Heart of Iowa Community Services, Dallas, Audubon, Guthrie counties, right? So we have 14 of them statewide. The biggest push amongst the kind of service changes was to get more crisis services for our kids, right? So here in Polk County, we now have our mobile crisis team through Broadlawns trained in work with children. And I was just at an event with them yesterday, and sometime in the next month and a half, that team will be trained and ready to go to be able to respond at times without law enforcement. Right now, law enforcement does come, and sometimes law enforcement is necessary to ensure people's safety. And at other times, they are absolutely not necessary, and there are other things that they could be out and doing, right? So they have been trained in some really good, strong models from across the nation to be able to get that going. The other piece of it was our crisis stabilization services, right? So today is 6 months and 2 days that we've been providing those services. So I have a potluck after this to celebrate our anniversary.
Talk about what that looks like.
Yep.
It is new in the community, and I think it was elevated because of, again, a lot of the work that Orchard Place helped to lead, and other tables we're talking about. We need that safe environment for that moment. So tell us what that looks like.
Yeah. So these services are available for any child and adult, actually, but specifically for this, any kid experiencing a brain or mental health crisis, right? So that is really broadly defined. Anything that you identify and your caregivers say, you know what, this is a crisis that we need some professional support with, it does have to be less intense than hospitalization. If you meet criteria for an inpatient hospitalization, that is where you need to be. And we have a system to get folks to a safe place in the state for psychiatric beds. We don't have enough, but we're working on it. Crisis stabilization is their short-term services, so up to 5 days residential or community-based services. Here in Polk County, the residential services are at Camp Sunnyside, which is up in the Sailor Township. We intentionally are in a quiet, healing environment. These are family-centered services. If you have a brain or mental health crisis, it is the only time you don't get to go in with your child and spend the night. We intentionally have set up so that if parents want to or need to come stay with their kids, they may. And that we're supporting kids as young. Our youngest client's been 3 and have had a couple of referrals for 3-year-olds. And kids as young as 5, 6, 7 who are making attempts at ending their life, who are hurting themselves. In that short time, you're meeting every day with a therapist and having a meaningful visit with that therapist. You're doing work every day on what your action plan is, meaning like, when these things happen in my life, this is my plan. The whole family should be engaged in that process and really are. Especially for younger kids, right? Like 7-year-olds don't know what to do necessarily when their younger sibling upsets them. But as a family together, we can work on what that looks like.
Tony, I think you should put a link to, and I think Jody, you should too, because I think Easter seals is really a best kept secret. Mm-hmm. I think when we don't have, I see people putting in here, like, can we share flyers? Can we share? Yeah, you don't have like one center place that lists out the services, and Easter seals and Camp Sunnyside, they're amazing. I mean, a gorgeous location with tons of opportunities, but it's not necessarily in everybody's wheelhouse to know what it is, how to get there, how to access it. And that's an issue because it's tremendous service.
Absolutely. And before I forget, I want to make sure folks know how to access those services, because this crisis, these experiences I think the department thought this was going to be mostly people on Medicaid, mostly low income families. We are really finding that well over half of our folks have a private insurance plan, whose parents are working full time. That the brain mental health crisis is affecting all of us. And so there's a few ways to get in, right? If you go to the hospital and you don't meet criteria, they will send you directly on over to crisis stabilization. Same with psychiatric urgent care. We have that for kids at Unity Point down by Lutheran Hospital. If you call mobile crisis, they will get folks linked in as well. For everybody else, the phone number to call is 515-288-0818. It's 288-0818. Someone will type that into the chat box for me. And that is a resource and referral line through community support advocates. It's staffed 24/7 by real live human beings who know the services in our area, who are live answering the phone all hours, who do a warm transfer over to us so that when Jody calls in the middle of a crisis, she doesn't have to write down this phone number and call someone afterwards, right? We can get to you straight away, right away. If we can't answer the phone, we respond within 2 hours. And we had 2 kids check in yesterday, one at 7, one at 9 p.m., right? Like these supports are available 24/7. Right?
One of the things too, as you're all talking, there's so much progress that individual organizations are making. Tony, I'm thinking about the work that you've expanded, your staff is expanding, the way that you've risen up to create the Stabilization Center. Jen, I think about, with Please Pass the Love and the support groups and the peer-to-peer networks that you're creating throughout the schools. Jody, I love this kind of innovative idea about this intake individual who can really help families, based on the intensity of situation. I think this is one of the best things about the sector is how you are all constantly innovating because you know why you exist and who you are here to serve. And so, this is such a heavy topic, like for parents, it's just for everyone in our community. So where are we seeing some more of those areas of progress? Like what really do we hope, you three as panel members, do you hope that the community can continue to push forward, because we know there's the potential for even greater impact on kids and families? What would be those progress areas?
I'll say
Tony are the progress areas.
Having the mental health disability services region in here, like having health services involved, has meant that they have been able to identify service gaps, right? So they're taking steps to do that. They signed up with Orchard Place's functional family therapy program, so we can finally get some intensive in-home family supports for kids who don't, before 2 months ago, you literally had to like assault your parent and get charged in order to receive these intensive in-home supports. And now we can get in there a little bit earlier and do some intervention, some really good, strong evidence-based interventions. And health services has been really good about getting early interventions as well, like for families of kids 0 to 5 through Lutheran Services in Iowa. So I really think having some more local eyes on what's going on has made a real difference in getting folks access to the supports that they need. We're not all the way there, certainly, but yeah.
It's grassroots efforts. Sorry, Jody. It's not, it's people like Jody and Tony that are experts, and me in the trenches, and we know best practices and we know how to get this done. It's not because of, bigger state or federal systems. It's people in the trenches that know how to do it in our foundations and our funders across the, when COVID hit, everybody wrapped around nonprofits because we were the ones feeding and hitting mental health pieces when nobody else could. So it continues to be those of us that are in the trenches at the grassroots level.
Other thoughts about areas that I just want to pause here for a moment? Anything else that you want to elevate in terms of what we would want to highlight as good successes that we've seen?
Well, I think we have a really unique program in a partnership with Unity Point, and it was supported by the Community Foundation, so I'm excited to share it. Our urgent care behavioral health partnership. So essentially what happens is we have a 5-day-a-week staff person located at Unity Point, and they see children that would otherwise be stuck in an ER for hours and hours and hours, and they see children that have behavioral health needs immediately. So, and they take them out of an ER that isn't designed to support mental health needs, and they put them into a situation where we can make those referrals to services if needed, very much like what Tony offers. We can do that, and we can do that quickly. We can do it in a much more comprehensive manner with this support with our urgent care behavioral health program.
Thanks for mentioning that, Jody. I think, and I should say thanks to the donors on the call too, who support the Better Together Fund, because that was a grant from the Better Together Fund to really help lean into this area and create tidal waves, as is the Crisis Stabilization Center. We've got donors who are supporting Please Pass the Love and did some adaptation grants to the organization. So it really, it takes all of us, but thank you so much for talking about that. We're so excited to be able to support that work.
And just to point out how innovative it is, it's the only one in the state of Iowa that serves children. So it's a big deal. It's a huge deal for our community, and something that we need to continue to focus on and make sure that there isn't an end point to this service.
Yeah, right. Well, and so all the expertise on this conversation is just so exciting. And we're talking a lot about what happens when there is a moment of crisis, or when families come and how they reach you. Can we just take a couple of minutes and talk about, what are the ways that our communities, our nonprofits, our donors can really support on the proactive side of things, really helping people not get to that point of crisis? What are some of the biggest areas of need that you would identify that people could lean in and support pre-crisis time?
So I want to link this to one of the questions that was asked. There was a question about brown and black bodies and mental health. And I don't want to mess up the question. I can't find it. Oh wait, I went in the wrong spot. So the question was, Can someone please elaborate on mental health discrimination, Black and brown, can't stop being brown and Black, isolation, 400 plus years stigma, called thugs and criminals, lack of opportunity. So when you say mental health discrimination, what do you mean? So there's this concept when we talk about how do we not let people get to crisis, there's a lot of things that have to happen, especially at a systems level, right? So we have to acknowledge that not everybody is having equal opportunities to exist. And so when we look at mental health, and especially as a system, whether it's access, whether it's racial discrimination, whether it's being LGBTQ and the discrimination that comes with that, microaggressions, weathering, generational trauma, poverty, lack of access to food, healthcare, all of these pieces are contributing to mental health. And so, you know, Tony mentioned in the crisis program and how they're trying to work, you know, with law enforcement, without law enforcement, that's a major issue. And so we can't pretend like some of these aren't issues because they're not comfortable. So when we try to silence things, even things like in the legislative session, we do a lot of advocacy. And this year there's been a lot of work to try to silence different history, whether it's Black history or Latino history. That impacts mental health, and that ends up contributing to more people ending up in crisis. And so as a world, we have to continue to educate ourselves on how this works, but we have to understand this concept of mental health justice too, that not everybody has equal opportunity. Not everybody has equal access. As a white woman, my experience is very different than those of folks that are Black, brown, Asian, indigenous. And so we have to make sure that our systems, we are dismantling the parts that are oppressive, and we're rebuilding with the intent of doing better than we've done in the past.
And we need representative providers, right? I mean,
Absolutely.
I am one of 13% of social workers who are male. And if I constantly am receiving, you know, calls, my child, my spouse wants to see a male therapist, but to think that also we and the Board of Supervisors is considering use of some of their ARPA funds for some ensuring that we have a more diverse mental health workforce, right? It is mostly people who look like Jennifer and Jody who do our mental health services in Iowa, right?
Certainly.
And people are more comfortable talking about what's going on with their lives with people who already know and understand their experiences.
Angie, I think it's also critical that we identify funding for parent education and easy access points, like at doctor's offices and our schools. We have to peel away those barriers to getting children screened. So oftentimes we get kids that come in that have been suffering for years. Parents have not been able to find their way through the system. We don't have easy access checkpoints, regardless of the color of their skin or where they're from. We don't catch them in the schools. We don't catch them at their doctor's appointments. We need to be able to educate our parents on what to look for, and we need funding to do that. We also need to fund transportation. So we have a huge issue here at Orchard Place, getting our kids to and from appointments. So if we could figure out a way that we could manage transportation for our families, our kids would only benefit from that.
Yeah.
So Jody, this concept of screening for kids. So can you just tell me a little bit more about like communities where that's done? Is that typically, who does that? What does that look like? On that, we do it for vision, right? I mean,
absolutely. That's exactly what I was just going to say, Angie. It's exactly what we do in our doctor's appointments for vision. So they're not optometrists, but they do a quick once over for their vision to make sure that we don't have any huge deficits. We could train our doctors, we could train our schools, we can ensure that we have mental health providers in all of our schools, not just the ones that need us most, right? All of our schools, because our kids grow up once, that we got one shot at this. And I know I keep underlining that, but I mean it. It's real. Tomorrow is not promised for our children. And we need to, as a community, hold hands and make this work. And we can do it in our schools. We have the system set up. We just don't have the funding to make it all encompassing. We could educate our providers, our doctors, our nurse practitioners to be able to do these screenings. That is not difficult. We could do that and really hit the majority of our population. We just need a little support behind it.
Mm-hmm. Oh, thank you so much. I love this conversation. It's exactly what I thought it would be. It's real, it's authentic, and I think it's getting a lot of folks in the chat and some emails that we're getting really excited about knowing, okay, what do we do? Like, what do you need us to do? So I want you to just think, like, what would be two things you would say? One thing, if you want to just really hit home hard here, but what do you want to tell the donors, the community leaders, the volunteers, the parents who are on this webinar today? If I were to say, what do you want them to do to support the overall mental health of kids? What would you say?
So I'm going to jump in here and just say from my mommy perspective, you need to listen to your kids. You need to hear what they have to say. Certainly around the school shooting that happened at East, we need to hear them. We need to assure them that adults are educated on how to manage difficult situations in those venues, and that they can be safe there. They're feeling very unsafe. So we need to listen to our kids, but we need to also make sure that mental health therapists have a living wage throughout our community. We need to make sure that this is something that we can recruit more men and more people of color for these positions, but there has to be a living wage to get that done. They'll end up with so much school debt, and then they make $45,000 a year or $50,000 a year to start out. And then I'll just underline what I said. We have to educate our caregivers, our teachers, our doctors about child development and mental health, and increase funding in that area. We just simply have to do it. This is a critical juncture for our community, and I think we need to embrace each other and walk hand in hand to save our kids.
Absolutely. To highlight what Jody was saying there, as I was getting ready for this, our graduate with their master's social work, right? They have a master's degree, could easily take a job at a call center and make the same, if not a higher salary, their first couple of years out, having just incurred at least $50,000 worth of debt for just tuition, let alone books, and maybe you want to live somewhere during that time, right? So the question was things we can do, right? Legislature is still sitting up there right now, and they are going through their budget process right now. Our mental health services in general, we've had a few little increases here and there in some services, but for instance, therapy rates have not been increased for Medicaid the entire time I've been licensed. So I'm pretty sure it was very early in the 2010s, the last time they had an increase. And so we've had some inflation even prior to 2021 since then to be stuck at those same rates. We can't increase our prices the way everyone else can, right? When costs go up. So they can take steps. They have not. And they can and should. That would make a big difference for us having real wages coming out of graduate school. They're also considering some loan forgiveness programs, some of them really onerous for some small communities to be able to take up, but they do have opportunity to make a real difference in our workforce. We are 44th in the nation for access to mental health providers. And we almost always only measure that based on psychiatrists, despite the fact that social workers do 85% of the mental health work in the nation, right? Oh, happy Social Work Month again, y'all. So those are my social worky things you should do. You need to call your state senator and representative and let them know this is important to you and you want to see it reflected in the budget, that they have some funds that they can and should expend on mental health in Iowa.
I think there's two things that are really important to think about. One is the big system piece. So that's how do we build a higher return on investment for the long run so that people can thrive? And then we're in crisis now. How are we going to help reduce the fires that are amongst us? So in terms of the system, going off what Tony said, you need to contact your elected officials, whether it's school board, Polk County supervisors, legislators. We need to be making sure that they're flushing through the decisions they're making. Remember, it isn't just a therapist in a school. It's not just about actual mental health providers. It's bigger than that. And so they need to be enacting policy that's evidence-based, I mean, we have decades and decades and decades of amazing research. We have schools and communities that are doing things well. We need to be using that as a model, not hijacking things for political gain. All of that doesn't help our kids, doesn't help our families, it doesn't help our young people. So we also need to be making sure that the people that are doing some of this leadership, running the systems, have lived experience. If you have not been through the hell, and it is hell as a parent navigating this system, or as a person going through this, you do not respond and lead with the same fury as somebody that does. So it needs to be people with lived experience. And then in terms of the fire, it goes back to what Jody said, listening to kids, elevating conversations. As an org, we launched after the suicides in a very metro district at the end of January, we didn't know exactly what to do. So we have a crisis sticker campaign, Your Life Iowa. We're promoting it across the state. We've gotten several sponsors, over $13,000 to be able to have stickers, and we're going to blast them in bathroom stalls. We're trying to get them in the come and goes, and they need to be everywhere, because otherwise what we're doing is we're setting up our community and asking them, go find yourself help. We're not making it easily and accessible. And so that's just one little piece that we're doing. But you elevating the conversation with your family, with your colleagues, with your faith institutions is so critical to start normalizing, as Tony said at the very beginning, mental health is a medical condition like anything else.
Absolutely.
Boy, oh, Jody, did I interrupt you? Sorry.
No,
Okay.
no, I was disagreeing. Yep.
Like, I think we're all like, oh, okay, it's so hard when there's so much system work. But I love, Tony, I was hearing you say, reach out to the legislature. They're there, hearing those conversations, elevating even the way to access through the sticker idea, Jen. I know that might seem minor, but it's important, and it'll be there when needed. I think opening up and having conversations about the impact of mental health in your own lives, and sort of modeling that way for others, and not being afraid to talk about it and talk about when you're challenged with things. There's one last question in here that I'm not sure we have an answer to, but when sending a list of emails, or sending a list of resources, which we will do, doesn't necessarily help parents in that moment of utter crisis, right? Or of what do I do? What would you tell them to do? What would you share with? What would be the first place you would try to go? Is there even something you could tell them so that the world isn't spinning around them, so that they at least feel grounded in an option?
They definitely need to connect with one of our organizations that has a community-based focus, so that we can find someone like through our IHP program or our BHIS program that can walk alongside them. Behavioral health intervention specialists and IHP, help me guys, I forgot.
Integrated health program.
Thank you, integrated health program. That you can have someone walk through this journey with them, hand in hand. So when they do hit those roadblocks, they know which direction to turn. And make no mistake, they're gonna hit roadblocks, and it's gonna be awful. And you're going to do it in a highly emotional time. It's just tough work, and make sure that they can connect with a professional to guide them.
Absolutely. And I would say if the ER is not the place for you, or psychiatric urgent care is not the time for you, 288-0818, you are going to get caring professionals who know what the supports and services are available in your community, and they're going to get you connected, because there is some hope in knowing that you're going to get some help.
Yeah, well, absolutely, Tony.
One thing's clear, there are a whole heck of a lot of people who care a great deal about this, and immense gratitude to the three of you, to your organization. Could not have been more grateful for the authenticity of this conversation, and just really look forward to helping work together to get better solutions for our kids and families. So Sarah, we'll turn it back to you.
Yeah, thank you all. Just to reiterate what Angie said, thank you, Jody, Jen, Tony, Angie, you too, for your vulnerability, your time today, the continued instrumental work you do in the community for our youth. I've gotten a lot of messages during this on how powerful this conversation is, how inspiring it is right now. So thank you again for all you do. We will be following up with an email to have resources to share the recording of this if you'd like to forward it on to your colleagues or friends or family. And as I close, I'd love to lift up Give DSM, which you see on the screen here. This is our community's online resource to connect donors with the timely needs of the nonprofit community. You can support projects listed by credit card or even by recommending a grant directly from your donor advised fund with us at the Community Foundation. We also do have a few upcoming events I wanted to make everyone aware of. And we do have the upcoming DonorConnect on April 20th, and also really wanted to uplift May 2nd. This is our celebration luncheon. This is when we're going to let you know what we've done, what we're planning to do in the community. It's our big celebration of our nonprofit community and our fund holders. So hopefully you can join us for that. That is all we have for today. Again, I appreciate this conversation so much, and I look forward to seeing you all at the next DonorConnect.